Hi guys, today we are joined by Dr. Susan Briley, who is a board-certified colon and rectal surgeon. Welcome, Doctor.
Thank you.
Today we're going to talk a little bit about hemorrhoids. Now, it can be a little bit of a touchy subject, I imagine. Let's start with what they actually are.
Okay. Hemorrhoids are just blood vessels that are covered with skin around and inside the anal canal. Nothing to be embarrassed or ashamed of. They're like wrinkles. Everybody has them to some degree, but they just bother some people more or get bigger in some cases. You can have hemorrhoids even starting at a young age. I've seen them in late teenagers on up to patients in their 90s.
Okay.
The anal canal has blood vessels that act as vascular cushions.
Mm-hmm.
And from straining or constipation or sometimes weightlifting, these vessels get engorged, they swell, and the inside part may actually fall out.
Mm-hmm.
So they're basically just blood vessels that get enlarged.
Sorry, what are some of the symptoms we can look out for?
The symptoms are first protrusion. There may be something back there that's sort of hanging out. Or just swollen. Some people have hemorrhoids all the time that don't really bother them, but they may become intermittently inflamed.
Mm-hmm.
Itching is a very common symptom. Bleeding can be a symptom of hemorrhoids. And occasionally, one of the hemorrhoids gets thrombosed. That means that one of the blood vessels breaks and forms a blood clot, and it gets kind of hard, and it may feel like a grape back there.
Now, let's dispel some myths here, because I know growing up, we used to sit on cold concrete and everyone would say to us, get off that concrete, it'll give you hemorrhoids. I mean, it's age old, everyone said it. I don't believe that to be true, but what are some common causes of hemorrhoids?
Well, we're not really sure because they're so ubiquitous.
Okay.
And I see people who do heavy lifting, who don't have hemorrhoids. I see secretaries who sit all the time who have horrible hemorrhoids.
Wow.
But I do believe that straining at stool, constipation, low intake of fiber can all contribute to the development of hemorrhoids.
Mm-hmm.
Pregnancy is also a big offender.
Pregnancy. Yeah.
I do see a lot of pregnant patients who may or may not have had any hemorrhoids before their pregnancy, and then they flare.
They flare, yeah. And what are some of the treatments that are available for hemorrhoids?
Well, we start really very simple. First of all, no donuts to sit on, no rubber rings, because that actually just increases the swelling and makes it harder. Second, I always recommend that the patient start taking psyllium fiber, which is a plant seed or husk that actually sort of holds water, kind of spongifies the stool and helps the bowel movement so that there's not that pressure causing the hemorrhoids to come out. So, the next thing is sitz baths. That just means soaking your bottom in warm water. There's portable sitz baths, or you can use a bidet or a bathtub. It doesn't matter, but warm water actually helps a lot. Then we move on to more invasive kinds of therapy. And the therapy is very much tailored to the kinds of hemorrhoids that you have. There's external hemorrhoids just on the outside. There's internal hemorrhoids. There's mixed hemorrhoids. And there's thrombosed external. So I'll start with the thrombosed external hemorrhoid. That is the sudden appearance of a hard, painful, grape-like blood clot that's covered with skin. If we can get to it in the first few days, I can actually excise that in the office, and it heals up in 24 to 48 hours, and then it's gone.
Wow.
Okay? Mixed hemorrhoids, where you have internal and external hemorrhoids, if you failed the fiber therapy and you continue to have swelling, bleeding, prolapse, may respond to rubber band ligation. That's a procedure in which we have an instrument that grabs the internal only part of the hemorrhoid, puts a little rubber band on it, and it sloughs off and scars down.
Wow.
Now, that treatment is not useful for external hemorrhoids.
Okay.
It's just for internal or the internal portion of a mixed hemorrhoid. External hemorrhoids or mixed hemorrhoids that often become itchy or flare up or swollen, if they don't respond to the methods that I talked about before, then surgery is indicated. And it is a big operation. It's outpatient, but it's pretty painful.
Sure.
And it takes at least a week off work. Some people require more time than that. And it is painful, but we do have good results from surgical hemorrhoidectomy. Another myth to bust is that we don't remove them with laser anymore.
Okay.
A lot of people think that, oh, I want a laser hemorrhoidectomy because it'll be painless. But the American Society of Colon and Rectal Surgeons does not recommend laser hemorrhoidectomy because of scarring.
Now, I understand that all majority of these procedures can be a little bit invasive, and I guess having a week off work as well. But the portion of their life prior to coming to see you, I imagine, is pretty uncomfortable as well. And is that generally the case? Is that people wait so long and they get such discomfort that they end up at your office, as opposed to kind of having some slight problems and treating it straight away? Well,
the best prevention for hemorrhoids is a good high fiber diet starting when you're a child.
Sure.
And avoid reading on the toilet. Get in, get out.
Yeah.
So those kind of things can be preventive, but we don't usually surgically remove small hemorrhoids. We actually, because it is so painful and they can come back, then we try to wait till they're a certain size before we remove them. And even though this is a very irritating, annoying, but common problem, hemorrhoids are not at all related to colon and rectal cancer.
Okay.
So you can live with your hemorrhoids. It can be very bothersome, but they won't kill you.
Yeah. Now, I imagine the itchiness and things like that could attract some sort of bleeding. Is there ways that perhaps there's infection and contamination or anything? Is that an issue?
Not usually. Not with hemorrhoids. They don't usually get infected.
Wow. Well, I think we've dispelled a lot of myths about hemorrhoids. And once again, I think this is a subject that guys like myself as well need to talk more and more about, because I don't think many of us like to talk about these sort of subjects. So I'm thankful for the time, Dr. Susan Briley. We've appreciated having you on. And if you guys need any more information about any of these subjects that we're talking about, and hemorrhoids in particular, then you can find all Dr. Briley's information at the bottom of the screen. And once again, thank you, and we'll see you guys next time.